Positional release for the pectoralis major. So often, if this is an area where we have some spasm, some pain, and maybe some discomfort for your client, it's also an area that's quite sensitive to work sometimes. So positional release is a lovely way to reduce that pain level, reduce the tone in the muscle without causing discomfort to your client. So in terms of positioning here, let's think it through. We're likely to try some flexion, given it's on front of the body, some adduction, bringing it across the body, and rotation. So we need to be able to ensure that we can do that with one hand while palpating the tender point with the other. So I find that working cross body works quite well with this. So instead of palpating with the arm close to the bed, we're going to use the opposing hand so that we can free the arm and shoulder to use it as a lever to create ease. So you may have already found your tender point with the client, but I generally tend to find they're closer to the shoulder part of the attachment, but you may indeed find that they're closer to the sternum, costal cartilage, depending on your client. So I'm going to palpate and find that tender spot first of all for that client. And how are we here? Okay. So if we're on that tender spot, we're going to call that our 10. So that's our monitoring point for this technique. I'm now going to use my arm closer to the bed to bring that shoulder into a little bit of flexion. Now, has that eased the tenderness?
Yes.
Okay, and where are we?
Probably about a 6.
About a 6, fantastic. So remember, each move we're going to recheck and then fine tune. Okay, so now I'm going to bring his arm into adduction, his shoulder, bringing it across his body, ensuring that he can relax and let it go. So you can see I'm supporting and holding his hand at the wrist here so that he can let his arm go. Has that reduced it further?
Yeah, maybe down to a 4.
Down to a 4, okay, fantastic. Now I'm going to bring in an element of rotation. Okay, so I've just externally rotated the shoulder. Has that reduced it further?
Yeah. I'd say down to 1 or a 2.
A 1 or a 2, and then we're going to hold for 90 seconds. So if that increased it or didn't make a difference, I would simply look to internally rotate the shoulder. So holding that position for 90 seconds, making sure that your client is nice, relaxed and supported in the arm. Depending on how much flexion, you may be able to rest the client's arm on their body if you brought them into adduction first, for example, with only a little bit of flexion. But we use quite a lot of flexion to get the ease on this position, so I'm just supporting the arm upwards. Coach your client to breathe. And when that 90 seconds is up, we just make a nice slow return back down to neutral. And then when we repalpate that tender spot and that tissue, you should feel a reduction in tone perhaps in the muscle, but most importantly is your client. So has that tenderness reduced?
Yeah, feels better.
Feels better, fantastic. So remember, communicate with your client, trust your hands and fine tune.